Welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. Our guest today is Dr. Gerald Wishner, director of the Minimally Invasive and Colorectal Surgery Program at Northern Westchester Hospital. And he's here today to talk with us about a new report from the American Cancer Society that suggests that colorectal cancer rates are rising sharply among younger people. Welcome to the program, Dr. Wishner.
Thank you very much for having me today.
Thanks for coming in. When I hear, colorectal cancer, I immediately get a middle-aged guy who neglected to get rectal exams his entire life. Now, anybody is a prime candidate for colorectal cancer?
Sure. So I wouldn't say anybody is a prime candidate for it because it's still, as you kind of alluded to, it's still a disease for the most part found in older individuals, patients in their 60s and 70s. But I think all physicians who treat patients with colorectal cancer have noted over the past, decade or 20 years that we're seeing an increased frequency in the number of 30-year-olds, and even occasionally someone in their 20s will be showing up with colorectal cancer. So, the younger patients still make up a relatively small fraction of the patients we see. The study you alluded to kind of validates what I think a lot of doctors have been saying, is that we are absolutely seeing a rise, particularly in younger patients, which is obviously very concerning.
Now, even though we've only got a few days of this month left, it is Colon Cancer Awareness Month. As far as this study is concerned, what is it that is causing this sharp rise, not just a rise, but a sharp rise among millennials and Gen Xers even?
Right. So, to understand, the background a bit, so approximately 90 to 100,000 patients in the United States are diagnosed with colon cancer each year, and maybe another, 30 or 40,000 with rectal cancer. Mm-hmm. And again, most of those are older patients. And through early surveillance and screening, mainly colonoscopy, we're able to detect cancers at a very early stage, and in fact, we're able to identify polyps in the colon, which are precursors to cancer. And if the polyps are removed with a colonoscopy, they don't have a chance to develop into a cancer. Okay. So we're very good at preventing this cancer, which is why pretty much across the board, the rates of colon and rectal cancer have been steadily dropping in the United States. Now, the only change, and what really shocked everyone when the study came out, is that although the rates are dropping in the older patients, we see an increase almost twofold plus in the younger patients, the millennials and the Gen Xers, as you say. It's a little bit unclear at this point to say exactly why that is happening. We don't have an answer for that quite yet. One of the things that we do note is that the rise in colon rectal cancer in the younger patients parallels the rise in obesity that we see. That's not to say that obesity causes colorectal cancer, but we do think that the same issues, the lifestyle issues, the sedentary lifestyle, the dietary habits that go along with obesity are probably playing a role in the development of colorectal cancer as well. And that's why we see it in that younger group of patients. But again, it's a little unclear right now exactly, what specifically is causing that rise.
As far as symptoms and early warning signs, do they vary greatly in the older patient and the younger patient? Should we be looking for different things in our younger population when it comes to colorectal cancer warning signs?
So I think that it's important to understand that for the most part, there are not a lot of early warning signs and symptoms for colorectal cancer, which can be one of the most concerning things. Obviously, just like with any cancer, the earlier you find it, the better off it is. The symptoms that we normally talk about, change in your bowel habits, right? Someone who's normally very regular and has a change. Seeing some blood in their stool. Now, blood in the stool is almost always going to be from something like hemorrhoids, some other benign condition, but it can be a sign of colorectal cancer. A change in the caliber of the stool, bloating and crampy abdominal pain. Now, I don't want to set people off and have everybody kind of run to their doctor, the second they see a little drop of blood or they get a symptom. So I think it's important to point out that with this type of cancer, there is no urgency to the point that if you waited a couple of weeks, if you waited a month to see how the symptoms play out, you're not impacting your outcome, even if it, in the rare case, it turns out to be colon cancer. So, if you have a little blood one day and you never see it again, you don't have to necessarily go run in. But if you have any of these symptoms that are lasting for days and weeks, you certainly want to bring that to your attention to your healthcare provider, to your physician, and have some, simple testing just to get a better sense of what might be going on.
Was this the aim of this study done by the American Cancer Society? Was it the aim to find out a little bit about the younger population as it relates to cancer, or was this something that was surprising and there was another goal of the study in the first place, another purpose?
So I think the study, and from time to time, we do look at incidents of cancers, and colorectal cancer being one of the most common cancers we see in the United States. Mm-hmm. So I think the aim of the study was more to just get a better sense. How are we doing in terms of our screening and surveillance? I think approximately 40% of Americans who should be screened, who meet the criteria, are still not going in for screening. So there's obviously room for improvement. So whereas this was just looking at the broader picture of colorectal cancer as a whole, then when you break it down and you look at it, for example, just in men or just in women or geographically or just in older and younger folks to see what you're doing, that's where this kind of popped up. And I think this was a bit unexpected in terms of the outcome.
What steps are you involved in, as well as with the American Cancer Society, as director of the minimally invasive colorectal surgery program there at Northern Westchester Hospital?
So here at our hospital, and I think most centers would tell you the same thing, we look at this as an ongoing educational opportunity. And certainly with this being Colorectal Cancer Awareness Month, as you pointed out, we are a little bit more aggressive in getting the word out and educating our community, whether we do seminars at the hospital open to the community, whether we have literature available, both online resources and at the hospital. Patients are coming in and out of the hospital, and their families are coming in and out of the hospital all the time for a wide variety of reasons. So we take advantage of that when it's, say, Colorectal Cancer Awareness Month. By the same token, when a study like this comes out, whenever there's a high-profile event, whether it's a celebrity or someone in the media gets diagnosed with colon cancer, or a study like this comes out that obviously has tremendous interest to a wide variety of people, we often use that as an opportunity, again, to go out there and educate, because I think the most important take-home message of this study is really just awareness and understanding that, yes, you are at risk. As you pointed out, you don't have to be 65, 70 years old. You can be 25 and 35 years old and get diagnosed with colorectal cancer. So by having some awareness that, yes, it can happen to you, you'll take some of these potential symptoms, seriously enough and go on to your physician and be checked out, because that's, early evaluation, early diagnosis is absolutely key to having a good outcome.
Right. There are some very invasive treatment methodologies when it comes to colorectal cancer based on the nature of it. Talk about some of the latest advancements in surgery for colorectal cancer.
Yeah, absolutely. So the vast majority of patients with colorectal cancer will require surgery as part of their treatment, and the cure rates are excellent, particularly when it's found early. It involves removing a piece of the colon and putting everything back together. The colon is essentially like a pipe, and you take a piece out and put it back together. And I think one of the myths that people don't understand is that once that is done, the vast majority of people will function normally. They will eat normally. They will have normal bowel movements. There will be no real limitation. A lot of people think they're going to end up, not put together properly, or they'll have to have a colostomy bag, and those are rare occasions. Now, the newer methods to do the surgery, traditionally this would involve a big incision, opening up the abdomen, a very painful recovery. Patients would be in the hospital for 7 to 10 days, be out of work for 6 or 8 weeks. Over the years, the technology, just like your cell phone, your computer, the internet, has gotten better and better. So too have surgeons taken advantage of this type of technology, initially doing minimally invasive surgery with a TV camera put in through the belly button. And over the past several years, robotic technology has really advanced dramatically in this area, to the point that we're doing major colon surgery, and most of our patients will come in, have 4 or 5 little holes that are about, half an inch in size, tiny little incisions. We do the operation with the robotic assistants, and the patients, for the most part, are going home the next day. So they're only in the hospital 1 day, maybe 2, and are back to their normal routine about 10 to 14 days later. With the same outcomes, the same results, the same excellent success rate. So it's really minimize the impact on patients in terms of the recovery. The robotic technology has enabled us to do surgical procedures with a level of visualization and a level of precision that was never really possible, prior to that development.
You mentioned the rarity of complications with traditional surgery. Is this robotic method, does it minimize the risk of complication even further?
That's correct. The very simply put, it enables you to see things much more clearly and much more precisely, and enables you to control the instruments with a much higher level of precision. And at the end of the day, having your surgeon see better and having your surgeon be more precise with the instruments can only be a good thing. As a result, what we're seeing is this minimally invasive approach with the little incisions is now possible in even more patients. So we're avoiding the need for that big incision and that big scar. We're reducing the need for a lengthy hospital stay, and we certainly know that the longer people stay in the hospital, it increases their risk of other problems, picking up an infection and other complications like that. So although even before we had this technology, because this is such a common problem, we've had time to refine the technique over many, many years and develop a technique that has excellent results and excellent outcome. This is just fine-tuning it even further. The operation we're doing is still essentially the same. In other words, we still have to remove the same amount of tissue. We still have to put things back together the same way. We're just using technology to enable us to do that at a just more precise level.
Dr. Wishner, where can our listeners go and get more information about this minimally invasive type of surgery and about Northern Westchester Hospital in general?
Sure. So certainly the Institute for Robotic and Minimally Invasive Surgery at Northern Westchester Hospital maintains a fairly robust web presence to talk about not just robotic colon surgery, but the other types of robotic surgery. The National Cancer Institute, the American College of Surgeons. There's ample opportunity to go look and do some research. Northern Westchester Hospital, nwhc.net online. And then you can easily link to the minimally invasive and robotic surgery subsection in that and learn more about it. And it's something that, because the development of it is still so new relatively, we've been doing this way for between 5 and 10 years, which is still a relatively short period of time in the field of medicine. Many non-specialists, your primary care doctor and things like that, may not be aware of it. So it's something you definitely want to talk to your doctor about should you need surgery, and you definitely want to seek out a surgeon who can do all the different types of surgery, both robotic and non-robotic, to determine what is the best, approach for a specific patient. The answer is going to be robotic the vast majority of the time, but, it's not everything is not suitable for everybody. You just need... Yeah, you just need to seek out someone who can discuss all the options with you, not just one option, should you find yourself in a situation where you need surgical intervention.
Well, I thank you for talking with us today, Dr. Gerald Wishner. Thank you so much for coming in.
Thanks so much for taking the time to help get the word out and share some of this important information.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Gerald Wishner. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can listen in and download on SoundCloud. Subscribe to this podcast on iTunes.